Assalamu alaikum and welcome back to the session. And this is the penultimate session of this course, which I am quite hopeful that you must have enjoyed and must have learned a lot. The whole exercise of the course was to be able to ultimately write a paper and publish your work so that it is read by other people. So I'm going to try and help you to give some guides on how to write a paper for a biomedical journal. My name is Hammad Ather and I am a professor of urology. And I'll share some of my experience, not only as an author, but also as an editor of some international journals. So I'm hopeful that you will benefit from our experience. So the most important thing and the most difficult thing is how to pen it down. We know that a paper which appear on the journal is in a format which is different from the format in which you're going to write your paper. So it consists of a title and abstract, introduction, methods, results, and discussion, and how this is how the way it appears on the journal. But this is not the way you're going to write your paper, and I'm going to go through some of the details of how each section is written and how you're going to essentially be able to write these sections without making mistakes. This is said by somebody and it is the basis of evidence-based medicine, which essentially means that you will make your medical decision about the management of the patient, about the diagnostic workup, using current best practice and evidence. And this is described more recently by Dave Sackett about 15, 20 years back, and it is called EBM, or evidence-based medicine. But look at this the saying from a very famous person, that one must attend in medical practice not primarily to plausible theories, but to experience combined with reason. So this is something that we know over 2,000 years back. And this is said by the father of medicine, Hippocrates. Now, the trainees and the residents and the junior scientists, their basic problem is to get an idea of how to write a paper and what to work on. So in order to be able to get an idea of what to work on, you need to focus on your day-to-day clinical practice. And while you are seeing a patient, or operating on a patient, or thinking about the possible diagnosis and management plan, if something comes to your mind as a question, this is a research question. Obviously, when you become a senior scientist and you work on laboratory and you want to do more basic science research, you probably have to do more in-depth analysis. But the baseline is that you have to formulate a precise question that is answerable. So a question which is too abstract and to be answered is not going to be of great help. The next question is the answer to the question important enough to pursue? Remember, doing a clinical study or doing a research project is a tedious process. And it requires a lot of hard work, it requires a lot of man hours, that it also requires sometimes money and get funding to be able to do that research. So you need to ask right from the beginning, is the answer to the question important enough for you to pursue? So if the answer to the question is pretty trivial and it's not going to make any impact, the question really is, should you pursue taking the pain of conducting a study? The next question is that you have a question and you are looking for an answer. You have addressed the first question, which is that it's important to answer this question. The next question is, does it add anything to the current knowledge? Okay. So, I mean, if the question has already been answered and in a much better way, is it worth duplicating the exercise? It sometimes is important to duplicate research work in order to provide a greater and a wider base for certain investigation. But generally, if the question has been adequately answered, is it worth pursuing that question again? That's the next thing that you're going to answer. Now, once you have addressed these questions, the next thing is that, does it simply confirm a previous observation? If somebody else has done a work on a similar project and they have found something, are you going to add to that observation? Now, if you want your paper to be published in a better journal, and our friend Habir is going to talk about in the last session of how to publish your article in a good impact factor journal, you need to ask this question to yourself: does it describe it better than before? So what you're going to do is a better answer than what is already described in literature. So the problem really is, all these things are important and they are something that you can pursue, but the problem is that how to get an idea. Sometimes you're lucky and you just stood underneath the apple tree and the idea comes to you. Sometimes you have to freshen up your ideas. And sometimes it is just the God's will to give you an idea. So in this organization, people are encouraged to take a bath here. But obviously, we are referring to the Archimedes principle. And Archimedes saying Eureka while taking a bath. Now, you can look at this vehicle from various angles and maybe you get a different picture. But if you look at this picture from one angle and you get multiple images and pictures, then it is something really intriguing. And this is what your research paper should be in order to be noticed. The cycle of research is, as I've said, starts with a topic or a research question. You then do some literature review to answer the question whether this has already been answered. And if it is answered, does it leave some queries behind, or there's some lacunae, there's some gaps in our knowledge that you can fill up with your research. And this is what the literature review will tell you. Once you're satisfied that what you're planning to do is worth doing, then the next thing is that you're going to design a study to answer that question. And obviously, your methodology should focus on how to answer the question. You have to make certain measurements. Obviously, that's your study and the outcome of those studies. You collect that data, you do analysis of the data, and that time you probably would require significant help from mathematicians and epidemiologists and biostatistics people in order to answer this question. And then obviously you make your own interpretation, conclusions, and then the cycle keeps repeating. And this is how researchers work. So again, idea, develop an idea, get the funding to do it, plan how to do it, record your observations, process your observations, publish, read, and then the cycle goes on. And this is how most researchers work who are serious researchers. Okay, so what are the different publication types? So a review article is basically looking at what has been published on certain topic. You search literature and you collect data from various sources and you write a review on a subject. Clinical studies are like original article in which you have a study objective, you develop a methodology, you get the results. And you can write for supplements, you can write case reports or case series, and these are called case studies. Sometimes these are short observation, particularly coming for people who have some background and who have the basic necessary knowledge to be able to communicate on the subject in a masterly fashion. Then there are abstracts and posters published in various conferences. And again, that's another important type of paper that you can write. I beg your pardon. Now, the problem is that there are thousands and thousands of articles which are published in biomedical journal. A smaller percentage of that, going into 1/4 of these, are Medline, so they are index medicus. Some of them are trial, some of them diagnostic studies. So essentially about 5,000 articles are deposited every day in the biomedical repository of information, of which about 15 to 1,700 are added daily to the Medline of PubMed. This is a peer-reviewed publications of some repute. 100 trials are reported on a daily basis. A lot of diagnostic studies are reported. The vast majority of these end up in what is called the bias and confounding trash can. So a lot of this exercise essentially lost. It is never read. It hardly makes an impact on the clinical practice. It's because it has biases and there is confounding factors that the investigators have not looked into. Well, as we know that publication of a research article these days is a tedious task. It's a difficult task. And sometimes it is quite long. It takes about 6 months to a year for one article to get published. So it's important that you take steps and you go in a methodical fashion to be able to improve your chances of publication in the shortest possible period. For that, the most important thing is to choose a journal. And if you want to send every research work that you have done to Science and Nature, obviously it could get rejected even before you have pressed the submit button. So it's important that you select the journal appropriately. And how do you make those selections? The factors that you need to consider is, what is the audience? What are the types of people who would be interested in reading your article? And then you select a journal that would accept that kind of articles. Go through that journal and see if they publish on this matter before, and are they reciprocal to that kind of material. Being realistic, it's always very difficult to be self-critical, but it's important to be realistic that the acceptance of certain high impact factor journal is quite low, and there is a very high rejection rate. Even up to 85 to 90% of articles are rejected in some of the high impact factor journals. So rather than wasting your time sending an article to those journals, you need to be very realistic about which journal you would send your article to. If you are a high-end researcher and you want to send your article to a good quality journal, you would look at the impact factor of that journal. The lead time is important if you want to have your findings becoming public in a shortest possible period. What kind of circulation? So very specialty journals are only going to be read by specialty people. However, if you write into more non-specific or generic journals, they will be read. So depending upon what kind of exercise you have done and what kind of paper that you are publishing, would it interest audience both in gastroenterology and cardiology? So you want to go on an internal medicine journal. Whereas if your work will only be read by an ENT surgeon, you don't want to go to International Journal of Surgery, because International Journal of Surgery, for example, or American Journal of Surgery is going to be more generic things read by surgeons who have a wider interest. They may not be very interested in a very specialty areas. Obviously, the most important thing is that journal to be part of the Index Medicus or Medline indexed, or PubMed index. And all these things are extremely important because that adds a little prestige and value to your publication. And again, these are important factors. Impact factor is something that is most commonly used, although it has been criticized by some people as well. But essentially, an impact factor is an indication of how widely read and influential the journal is. So, and I'll tell you how to calculate the impact factor. And this is calculated by citations. And citation essentially means the frequency of average of an article in a journal which is being cited by other journals. So number of citations to a journal over a period of time divided by the number of citable items published during that period is how you calculate the impact factor. And let's look at how it is done. It's pretty straightforward. So how would you determine the impact factor of a journal? The journal A citation in the year of 2020. So we will look into the journal A has published 500 articles in year 2018 and 488 articles in 2019. So the total citable items published in that journal in 2-year period preceding is 988. Now the article published in 2018 and 19 are 1020 and 1200. So the calculation is made, the number of citation and the impact factor of 2020 will be the number of citations in 2018-19 period, an article published during that period, and you divide the two, and what you get is 1.94 figure. So, sorry. So essentially, each article published in that journal has 1.94% chances to be cited. So the higher the impact factor, the more are the chances that the articles from that journal will be cited by other journals and by other people. So it's quite variable. Unfortunately, the impact factor of journals published in Pakistan is very, very low. If you look at the impact factor of some of the other top journals in surgery, the impact factor is Journal of American College of Surgeons is 14.7. Whereas if you look at the Bone and Joint Journal, the impact factor is low, it's only 1.97. It's not because that their articles are not very worthy, but that it's a very specialty journal and it is cited by a very smaller group, relatively smaller group of individuals. So it's typically, if the journal is publishing a very specialized work, it will only be published and cited by very specialized authors. So the impact factor generally is low. Impact factor of one of our journal, European Urology, is 17, which is really quite high for specialty journals. So when you're deciding about journal selection, your first question should be that who's going to read your paper. Now, do you want it to reach specialist, multidisciplinary researcher, or a general audience? So you may select a very non-specific journals or more generic journals, which is read by a nephrologist as well as a urologist and a cardiac surgeon as well as an orthopedic surgeon. So do you think that your article would be of interest to most of those readers? So you send it to a... Now, when you send an article to a journal, specific journal, you need to make sure that you are adjusting that article according to the guidelines to authors. So not all journals have a similar way, and the organization of paper is different in various journals. Their instruction to authors basically describe what. So sometimes when you send it to one journal and it gets rejected without any changes, you send it to another journal without modifying it to the needs. Your article is going to come back saying that it has to comply with the requirements of that journal. In the olden days, it typically takes weeks and months for the journal to send the article back and say that we have not even sent it for peer review because it does not comply to the author's guidelines. So you have to now change that, and these are the things that you need to focus on. Read our author's guideline, and then so you've wasted 6-8 weeks. Nowadays, because most of the journals have online platforms for submission, their software is smart enough to pick up inconsistencies in your manuscript and that it's not in accordance with the instruction to authors of that specific journal. So it does really come back quite quickly because the software checks it and sends you immediately back. Well, it's important, and this is something that sometimes people make a mistake, and these are considered as grievous mistakes, and you should be very, very careful about. Do not scatter your paper. People think that, well, the article is likely to be rejected by 1 or 2 journals or 3 journals. So why don't send to each one of them, and whichever accepts first, it will be published there, and then you can withdraw it from the. Well, that's absolutely not acceptable. And when you're writing the letter to the editor, you have to say it very explicitly that you have not submitted in any other journal. So you have to only submit it at one time in one journal. Otherwise, it is considered as an unethical practice. And sometimes, and then in the modern era, well, it will be picked up quite quickly, and it can actually constitute action against you as well. Well, this is a little background of how to deal with your manuscript. Now we're going to go into the specificities of how you're going to organize your paper and how you're going to write various areas. And I'm going to talk about each one of them under the heading of the writing process. Right. So now we're going to go into the details of the process. Before you start to write, again, you need to reassess your work. Have you done something new and interesting? Have you checked the latest results in the field? Have the findings been verified by appropriate analysis and their significance verified? Are the methods measurement valid and reliable? Once you have done the study and you've determined all the values, you need to be sure that there is no mistake, because once it gets published, you have actually given a surety that you have doubly checked and you have read it yourself and you have done recheck on all the data, and once it is published, it's your copyright. Copyright is actually with the journal most of the time, but again, it's your intellectual copyright, and you own that data. And if there is something erroneous in that, you're responsible for it. You should be able to determine the scope and limitation of the methods. Do you feel that the story is incomplete and there are certain lacunae and areas that the future researchers can work on? And this is important. Is it something which is really contemporary and hot in the current time? So if you talk about something very archival, like an open cholecystectomy in 2022, obviously people would have very little interest in that. Have you provided a solution to a difficult problem? So all these things will make and sell your article well, if you've taken consideration into all this. Well, the format of the paper, you need to consult and apply the list of guidelines in the guide for authors. And I've said earlier that your paper, once you've selected the journal, you should look at the guidelines and comply your manuscript according to those guidelines. The nomenclature, abbreviations, and spellings, whether it's going to a British speaking journal or an English journal versus an American journal, you have to make sure that you've made the corrections accordingly. And you can just nowadays change the word Microsoft Word thing into English, British English, or American English. The layout is correct according to the recommendations of that journal. The reference format is again very variable between various journals, so it's important that you look at that format. Otherwise, you have to redo all the references. The statistics should be rechecked, reassessed, because as an editor, I can tell you that one of the questions as a reviewer and as an editor that comes to us is that does the statistics of this journal needs to be checked by the statistician of the journal. So if you have made errors and it's picked up by the statistician in the journal, your paper is going to be rejected. You need to comply to the word limits. Authors, journals sometimes describe the overall word limit of an original article or a review article or a short communication. Sometimes it is for each section, and sometimes it is for the whole manuscript. The tables count for X number of words. Typically, each table is taken for 200 to 250 words. So if you've added table, then you added this to the word count. So if the allowed word count is 4,000, your manuscript is 3,500 words, and it is calculated from introduction to conclusion. So introduction, methodology, results, discussion, and conclusion. This is how the word count is calculated. And it should be, say, for example, 4,000 words. Your manuscript, 3,500 words. So you have 500 words left now. You can add two tables or two figures, or one table or one figure, and they will amount to about 500 words. And this is how you comply to the 4,000 words. So you have three tables. The author, the reviewers, or the journal editorial team is going to ask you to comply to the word. So although published paper appears in the IMRD format, which is introduction, the methods, the results, and discussion, this is not the way you write your paper, and I'll tell you why. So introduction is not introduction to the topic. So for example, if you are working on robotic assisted partial nephrectomy, and you start talking about kidney tumors and nephrectomies and open nephrectomies, you're not going to write the history uh, of kidney cancer and nephrectomy. Your introduction is only a specific 2.5, 3 paragraphs, short paragraphs. And they should answer one simple question, is that why did you start to work on that subject? When it comes to methods, what did you do? How have you done that? And you need to describe it as you have performed the study, and with an intent that if somebody wants to duplicate your work, he or she will be able to do it by reading your methods. Results is what did you find? So your outcomes, your essence that has come from your methodology is your results. And then in the discussion section, you will discuss your findings in comparison to the findings so far reported in literature. So what actually your finding means. But when you're writing a paper, the sequence is methods. You will write the methods first, obviously. It's quite simple. You know exactly what you have done and the way you have done it. So write your methods first. Once you have written the methods, then what has come out of your methods is your results. And then there is discussion and conclusion. Number 4 comes the introduction. In the end, you're going to write the abstract. It's the most difficult part. You have to summarize your whole paper into 250 words, or sometimes I'll allow you 300 words. So your 3,000 or 4,000 word paper has to be summarized into 250 words. And this should be done right in the end once you've written all that. And then obviously the title and then the rest. So let's look at the structure one by one, and we will talk about each section of your manuscript and what are the do's and don'ts. So the title, authors, abstract, and keywords, they are all important. They are important because based upon this information, your article or your published work will be screened using these by the search engine, the keywords by the search engine. So, for example, if you want to get information about open versus lap appendectomy, and if these words are not included in these areas, which is title, authors, title, abstract, and keywords, your paper will never be picked up. So in millions of publications on the subject, your paper will never come into. So it's important for indexing and searching that you write these carefully. And then obviously we are going to take into account how these various other sections of your paper, which is introduction, methods, results, and discussion and conclusions, are written, and each one has distinct function. And we're going to touch upon each and every section so that you are able to the other things as well, like the acknowledgements. So somebody who has helped you in the manuscript, but that help does not qualify him or her to be a author, then they go into acknowledgements, references, and then some of the supplementary material, which is now becoming more and more important because the journal wants you to submit your supplementary material. Sometimes you provide supplementary material anyways. So simple experiment. a heavy thing and a light thing. The universal rule is that they fall at the same rate. And then obviously there's somebody who is doing the study, is this gentleman who is throwing the two pieces of rock. One is a heavy one is a small one. And then this gentleman is observing if they are falling at the same rate. The question really is, who is the primary author and who is the secondary author? Now, that sometimes becomes a difficult issue, and if it is not tackled right in the beginning, it can actually create problems later on. So each author must meet 3 criteria. So in order either one of these gentlemen becoming authors, first of all, is that they should be involved in designing the project, collecting data, or analyzing the results. They should also be involved in participation, drafting, and revising the manuscript. And they all must have approved the final published work. So these are some of the essential requirements for an author to be part of it. And it's important that it is understood who made a greater contribution in order to decide about the sequence of authorship. So who's going to be the first author, who's going to be the last author, who's going to be the corresponding author. Corresponding author is the one who will be dealing with all the correspondence that comes between the journal and the author. This one person is going to respond to the queries, obviously sometimes in consultation with the other authors. So these are important positions: the first author, the second author, the corresponding author, and the last author. The last author means that he is the head or she is the head of that investigative laboratory or university and heads that research team. So some of the journals ask you for the credit author statement, which means what is the contribution of an individual author. So has everyone participated in design of the study, collecting data? It's not necessary that all authors should collect data, and all authors analyze data as well. But the designing of the study is something that they all have contributed in one way or the other. So each individual contribution should be specifically marked. There are obviously diverse contributions to the research work. The corresponding author, as I've said, is responsible in ensuring the description are accurate and agreed by all authors. So whatever the corresponding authors communicate to the journal essentially is on behalf of all the authors. So it's important that whenever you decide about a corresponding author, that person is able to communicate and get in touch with all the authors. As I've said, that some journals want you to actually list what you have done in the relevant categories. Some authors may have contributed in all or most of the areas. Some may have contributed in certain key areas, and that's how you determine the authorship sequence. So what are the various credit statements? Well, conceptualization, as I've said, is important, which means that who got the idea, formulation and evolution of overreaching research goals and aims, who was involved in conducting the study, and these are the ones who are in the development, design, and creation of models, and they are the methodology part. Software, sometimes it is required for programming and development and developing algorithms in order to do the research in a proper fashion, and testing various things. Then there should be somebody who has done validation studies. So in order to be able to provide validity to the existing, to the statements and to the experiments, somebody should be some other person who has done the methods and should be able to do the validation. Analysis of the data, which means that you compute, you put it into softwares, and then you drive outcomes, is done by somebody who is responsible for resources. Is again important. So you have to write which person is responsible for the resources. The data curation is a very important step. So scrubbing a data and maintaining the research data is now very, very important. And sometimes the authors are requested to send the raw data. Then the writing of the original manuscript, and then obviously writing and reviewing and supervision of that writing process, and ultimately the funding, etc. So all these are various graded statements that we need to scribe to specific authors. Now, as I've said, that there are certain steps. Not all authors are supposed to. Who should be listed as an author? And as I've said, that not all authors have to do everything, but there are certain important things that you need to do to be part of as an author, not as an anthology. So you have to have a substantial contribution and perception and design of the study, some involvement in data acquisition and analysis, data interpretation, drafting the manuscript, revising it for intellectual content, acquisition of funding. So these are important things, and you need to write that this is what you have done. Literature review, which is an essential part of writing a manuscript, and various resources which are available. And I don't think I need to go into that because these have been covered. So while you're doing literature review, you need to look at 5 or 10 years, depending upon the kind of work that you're doing. You need to shortlist 20 quality papers on that subject, read them. For a review paper, you really need to be looking at something like 50 papers. List the concepts investigated in these papers, make notes, and that's how you'll be able to write a good discussion on the subject. So when you're writing the material and methods, what you should be including in that section, how the study was designed, keep it brief, and how the randomization was done, if it was done, how the study was carried out, meaning how to describe the participants were recruited, giving reasons for excluding participants, and if it's a randomized controlled trial, writing a consort or a statement in order to describe each aspect, each step in which the patients were in, the study subjects were included and some of them were excluded. You need to describe why it was done. So otherwise, if you don't do that, there will be an element of bias in your methodology and recruitment process. You have to mention the ethical features and ethical approvals, and these are important now, and most of the journals nowadays do not accept articles which have not been approved by the ethical committees. The data analysis and how the data was analyzed, the probability values, what was the hypothesis. I think these are some things that you probably have already discussed in previous presentations. While an editor is looking at your paper, the methodology section is one of the more important ones, and they look at very clearly. And one of the reasons for absolute rejection of paper is it's poor, the methodology is poorly written. So the method section should be the bulk of the paper and must provide sufficient information so that knowledge knowledgeable reader can reproduce that experiments. And this is the essence of writing a method so that somebody else doing the same study is able to duplicate the work. Again, just to summarize, the method section should define the population and the methods of sampling, describe the instrumentation, describe the procedure, and if relevant, the time frame it was done in, the analysis plan, approaches to ensure validity and reliability. So if you have done an experiment, how did you make sure this experiment is done according to the standard criteria, and you have ensure the validity of your outcome. And then obviously it's important to write down the scope and limitation of the methodology section. Okay, so this is about methodology. Let's move on to the results. And results basically is an overall description of the major findings of the study. So what you have found out, and sometimes I find the junior researcher have difficulty in separating some of the points, and they're not clear whether they should go into methods or into results. So how you have done it is methods. What you got out of those experiments or data collection is results. So it should be clear and concise. It should not be repetitive, meaning that you don't have to make a figure as well as write it in the text format, or make a table and write it in the text format. So they should not be duplicated. Number two, that the figures and table easier to read. They save time and space. They should be properly labeled, good legends, and they should be standalone. So if somebody just looked at that table, one would be able to find out exactly what is being done. And there should not be too many of them. They add to the value of paper, the figures and tables, but there should not be abundance of those things. So in result section, don't duplicate data between table, figures, and text. So if you have provided a figure for something, you just refer it to the figure 1 as described in figure 1, rather than describe the figure 1 in the text and as well as provided the figure. Same thing for the tables. So if you have described the age, gender, distribution, and other demographic things in the text format, you don't have to make another table for it, and vice versa. Well, you use graphics to illustrate data that can easily be summarized with text. So they're more impactful than the text. What you should do is use figure and table to summarize data, because obviously the presentation is better. Show the results of statistical analysis, confirm that the method is reliable, justify the choice of methods, and define the limitation of the methods. Well, a picture is worth 1,000 words, or is it? Photo without words may be almost meaningless. It's really a combination of the two, although a picture adds a lot, but sometimes it is not a piece of art, it's a science, and you need to have proper legends and proper description to show what this figure essentially is about. So reader often look at the graphics first and many times go no further. If the reviewer should be particularly sensitive to inclusion of clear and informative graphics. So these are all important consideration, and how much information be there in the table. If something can be easily described in a few words in the text format, there's no point making a big table for it. The line graphs versus bar or pie charts really depends upon the kind of data that you have. So in terms of graphics, the figure table are more effective. They are ways to present result, but caption should be able to stand alone such that the figures and tables are understandable without the need to read the entire manuscript. So that's an important consideration. The caption should contain should not contain extensive experimental details that can be found in the text. In the methods section, the data represented should be easy to interpret. Color should only be used when necessary, because some of the journals will charge you for publication of colored graphs and colored figures. And then obviously it's quite expensive as well. So if you look at this, beg your pardon. So if you look at this graph versus this table, what is more effective? And I think this is a question that you need to ask yourself or ask a colleague to look at it. It's sometimes difficult to be self-critical. Ask your colleague to say what is better. Sometimes the figures are really very poor. And if you look at this figure, it says change in symptom score with time. Week 1, week 2, week 3, week 4. What is happening here, and with the use of drug A, drug B, or drug C, or 1, 2, 3, the legends are poor. The treatment options are not mentioned. Can you read the actual percentages? No. So this is a very poor figure, and you should avoid such figures. Again, if you look at this table, really a poor table. Again, with the legends are inadequate, abbreviation are not spelled out, so people may not know what DHT is, what T stands for. Well, maybe I know that this stands for dihydrotestosterone, and T for testosterone, and PSA for post-specific antigen, but most people would not. So you have to write the description as if the reader is not really aware of those. And sometimes these abbreviations are not very standardized as well. So you have to describe these abbreviations. So again, a poor quality table, and this could easily be represented in less than a sentence in the text format. When you're describing your statistics, it's important that you indicate the statistical method used with all the relevant parameters. So have you determined the mean or the average or the median, and is it with standard deviation? So write proper signs. It's important that you write denominators and numerators and not just percentage. So 40% may not mean anything. It may be meaning that 4 out of 10 or 8 out of 20 or 40 out of 100. So you need to write the denominators and numerators for people to be able to understand. The means and the standard deviation to report normally distributed data. For abnormally distributed data, there are other ways of describing. So statistical method, you need to discuss it with the statistician if you're not very good with it. So if you want reporting a p-value of 0.0035, it's better rather than just writing that it was less than 0.05, because 0.05 is really a cutoff of the p-value, if it is significant or not. But how significant it is depends upon how low the p-value is. So it's better that you write the full p-value rather than just less than 0.05. Let's take a few minutes break and maybe get a glass of water or something. I'll play some music. Okay, so back again. Let's talk about how to write your discussion. We have done the methods, we've done the results, and now we move on to discussion. Well, you have to, in discussion essentially means that you discuss your results. You don't discuss the history and the background of the disease or the condition or the procedure that you are describing. You have to discuss what have you found out and how they compare it to what is already known on the subject. It should not be too long. You provide a summary of the findings. Do not add new data or results in your discussion section. They should all have been discussed and described in the results section. Do not repeat the results. You can refer to your results and they say that what others have found out. Do not extrapolate. You only describe an actual result. Explain conflicting data. If there is something which is not in line, you need to describe that. Do not claim novel theories on small amount of data. So be careful. It's not fiction that you're writing. This is science. Well, when the editor looks at the discussion, the length of discussion should not be more than 1/3 of the total length of the manuscript, which means introduction, material, method, results, and discussion. So if that is allowed, it's at 3,000 words, your discussion should not be more than 1,000 words. Again, when the editor looks at your discussion, you should avoid the temptation of citing all the articles that you've read on the subject. You only describe pertinent and significant articles related to the area that you're discussing. So determine what is the most relevant and always in relationship to your data. If there is something different from in your data from the other authors, then you have to describe why this outcome is relevant. Why is your data similar to the literature and still relevant? Needs to be described as well. So discussion is the most important section of the article. Huge number of manuscripts are rejected because the discussion is not appropriately written, because you're actually now discussing your results. And if it's not properly written, then it lacks the necessary push that is required in order to publish those. So what your result when you're describing your discussion, you need to answer this question that what are your result mean? What are the methods? Were the methods successful in achieving the objective that you've set forth in the beginning? And how did the findings relate to those of the other studies? And what are the limitations of your work? So some of the tips for writing discussion is that the discussion corresponds to the result, but do not reiterate the results here. Do not make grand statements that are not supported by the methods or the results. For example, this novel treatment will massively reduce the prevalence of malaria in the third world countries. Well, not going to go well with the scientific community. Do not introduce new terms not mentioned previously in your paper when you're writing discussion. Avoid unspecific expressions such as higher temperature or lower rate. You need to give values. Speculation on possible interpretations are allowed, but these shouldn't be rooted in fact rather than imagination. Compare the published results with your own, but do not ignore work in disagreement with your. Confront those results and convince the reader that you are correct or better. So in essence, the discussion, first paragraph is a brief summary of your major findings. Next comes a review of previous publications, followed by discussion of the differences between the present study and compared to the previous ones. And then you describe that present study, new information, and or simple confirmation of the old work, and that the paper should also include some comments on the strength and limitation. So 4, 5, 6 paragraphs that you're going to write, and this is what the focus of your paragraphs or 1,000 words of your discussion section should be. Conclusion, describe how your work advances in the field, indicate application of your work. Do not make tall claims or conclude something which is very generic or maybe true, but it's not the outcome of your work. So suggest future experiments that build on your work and point out experiment already underway as well. So the tips for conclusion is downplaying the negative result is not something. As a scientist, you should report if your outcomes are negative or positive. Making a statement based on personal opinion without scientific. So that's not what you should be writing. Repeating other sections and overemphasizing the impact of your study. Well, the second last portion is introduction, and it is used to provide the context of your manuscript. And the last paragraph, your introduction, should be the rationale for the study, why you have performed that study. The question that you're going to address in introduction is, what is the problem you're ultimately trying to solve? Are there any solutions available? What is the best solution? Why this solution has a limitation, and what are you going to achieve by doing this study in order to get an answer to that question? So when you're writing your introduction, be brief. Usually 1 or 2 paragraphs is appropriate. Long introductions will create a problem for your word limit. So, and also puts the readers off. So they start to read a long introduction, they would just get put off. Remember that if you're writing for specialty journals, these authors, the readers are quite well versed in the basic things. So you don't really need to describe that the stone was first identified in the Egyptian mummy. When you're describing some modern methodology of stone fragmentation using laser. Introduction of letters are even shorter, so try not to make this section into history lesson. Cite a couple of original and important works, but do not add so many references in your introduction. So the tip is, do not mix introduction with result, discussion, and conclusion. Expressions such as novel, first time, first ever, paradigm changing are really not, goes well with editors. Define any non-standard abbreviation and jargon right in the beginning. The real last portion is your abstract. The abstract should be state concisely the principles of objectives and scope of the investigation. And more importantly, it should concisely summarize the results and principle of conclusions. All information included in the abstract must be found in the text. The abstract should be the last section of the manuscript to be written. Once you've done all the work and you've written the whole paper, you make a concise statement of 250 words in your abstract. It is structured or unstructured, depends upon the journal that you're choosing. But basically, it follows objectives, methodology, results, and outcome or conclusions. And it can be in a structured or non-structured format, really very depends upon the journal. The quality of abstract is strongly influenced the editor's decision. So personally, I've been a reviewer and an editor for over 10 years. And the first thing that I read is the title and then followed by the abstract. And I read abstract once, I read abstract twice. And if the third time it doesn't make sense to me, I reject the paper. I don't really need to go into the details. So abstract has to be very well written. A good abstract is precise and honest. It can stand alone, and majority of the readers are only going to read your abstract. So it should stand alone as one piece and provide the gist of. Very few people will go and read the details of your paper. Use no technical jargons, minimize the use of abbreviation, and cite no references in your abstract. So convey main research findings in your abstract, be specific, be concise, be complete, and attract readers. So don't use unnecessary jargon, don't use uncommon abbreviations, don't use ambiguous terms, unnecessary detail, focus on part of the contents only. So good abstract is basically concise statement of all your work. So it's really निचोड़ जो आपकी पूरे manuscript का होता है. A good title should contain the contents of paper in fewest possible words that adequately describe the contents. So, preliminary observation of the effect of metoclopramide in patient post-operative ileus. That's one title, not a good title. Whereas effects of metoclopramide in patient with ileus, it's concise, state, and it communicates all the essence of the first title, but in fewer words, and this is considered as a better. So long titles actually distract readers. They remove all redundancies in your title. Action of antibiotics on bacteria. Well, it's very generic and it does not really attract anyone. What you're really talking about is inhibition of growth of Mycobacterium by streptomycin. So write this rather than write that statement. Okay, I think I'll stop here, and this presentation is followed by Dr. Kabir, who's going to talk about how to select a good quality journal, high impact factor journal. So over to our moderator, and then to the last presentation of this course. So thank you.